Inventory Management, the Birmingham Free Clinic. The Birmingham Free Clinic is a community partnership between UPMC's Program for Healthcare to Underserved Populations and the Salvation Army. Located in Southside, the clinic utilizes a team of volunteer healthcare providers to serve the uninsured and medically vulnerable. Many of the supplies used at the clinic are provided via donation, and the remaining supplies are purchased on a stringent budget heavily funded through grants.
The clinic's inventory management was recognized as an area with several opportunities for improvement. Medical supplies such as gauze, sutures, and gloves were stored in large cabinets with minimal organization. Without designated storage locations, tracking inventory level of different items was cumbersome and inaccurate. Furthermore, backstock of many, but not all items, is kept off-site in a storage room at UPMC Montefiore. This led to a two-step reordering process with significant lag time. These factors led to the following issues: inventory stockouts of fast-moving items, excess inventory of slow-moving items, excessive time spent counting inventory in an attempt to determine which items needed to be reordered, and the expiration of slow-moving items. Additionally, there was no data-driven system for the reorder of supplies. Minimum safety stock quantities existed for many items, but were often inaccurate and rarely observed.
To address these issues, the project team started by implementing a new Kanban-based inventory management system. The supply cabinets were organized such that each item had its own labeled product lane. Reorder cards that show the name, location, and reorder point for each item were made and set in their respective product lanes such that the minimum inventory quantity sat behind the card. When the last item before reaching the minimum quantity is used, the card falls forward and must be removed and placed in a designated and marked basket. After working with the system for about 1 month, the system was reevaluated and feedback from the medical assistant was taken into consideration. Several 5S methods were employed, including the organization and labeling of most horizontal surfaces in the exam rooms and storage area. The exam rooms were integrated into the inventory management system by ensuring that the inventory storage location was marked for each item used, so that empty stock can be immediately recognized and replenished easily. Methods for simplification of the process were also explored. Appropriate signage was made for the cabinets and explanations for how to use the card system were made available. In order to eliminate double handling caused by the off-site Montefiore storage facility, a new area was sought out to serve as a storage location for overflow stock. A non-functioning shower area was deemed to be a serviceable storage area, and it was recommended that excess stock be moved to this on-site location. Finally, the inventory management system was fully explained to the entire staff.
This project has significant social, financial, and environmental implications for the Birmingham Free Clinic. From a social standpoint, reducing the number of stockouts and expired items, in other words, the risk of not having supplies for proper patient treatment, is mitigated, while standardized exam room inventory helps ensure that customers get consistent treatment with each visit. Due to a reduction in labor hours needed, items that expire before being used, and excess inventory supplies, the clinic should see a substantial net savings, financially speaking, meaning that more time and capital can be allocated to helping more patients. Finally, the reduction in wasted goods means a smaller environmental impact by the clinic, reducing the plastics and other non-renewable resources over the production life cycle of each stocked item.
In addition to these considerations, the following results were found. In the original process of counting inventory, it was necessary to search through the various cabinets for each item before counting the stock on hand. The medical assistant would then have to decide if the quantity on hand was enough to last them until the next ordering cycle. This process would then be repeated for each item. In the new system, each of the time-intensive processes have been removed. It is no longer necessary to search the cabinet due to the itemized list, count each product due to the Kanban cards, or decide on an order quantity. If the Kanban cards are collected continuously, inventory collection is as simple as glancing in each cabinet to ensure no cards have been left behind, and collecting the cards in the bin, then entering the product that the cards indicate as needed.
To continue the improvement begun in this project, we have a number of recommendations. Any new staff must be trained to use the inventory management system. Although the technique is simple for users, this training will help prevent potential problems caused by new volunteers. Furthermore, the management will need to enforce the system and its use. Backstock at the Montefiore facility must be relocated to an on-site storage area to eliminate double handling. Flexible inventory space should be available for future crises, such as the recent Ebola concerns. For each of these changes, the cost and spatial implications of each action must be considered before implementation.